Okay, so it looks like we are now live. So welcome everyone who is watching and hanging out with us live. This session is who's hiring now, what they're looking for, and key things to consider. So before we jump into this talk, I wanted to give everyone who's watching with us live an Easter egg. You want to take this code and enter it as a code for the purpose of the raffle. It is one word, all caps. This will give you additional entries into the raffles. And the code here is HMO. HMO. So welcome again. And, there's no doubt that the current landscape of jobs is vastly different now than ever before. There's a lot of companies who just aren't hiring right now. Large companies, small companies, let alone private offices and practices. We've seen definitely the landscape of jobs change over the last last several weeks or so. And, in this session, in this live session, we wanted to talk about companies that are hiring right now and just, talk about the current state of job trends, affairs, maybe some key things to consider as you navigate jobs now and, into the future, even when this is over. What do jobs look like then? What is the landscape then? So I'm joined today by, some members of our team, Brett Kestenbaum, co-founder of Covalent Careers, Preeti Shaw, one of our senior lead recruiters. And we've got a special guest who's going to be joining us in just a few moments as well to kind of weigh in. So before we get there, let's kick it off. I mean, Brett, you kind of spend a lot of your time, focus, and energy, and even you, Preeti, in this area. What have you guys seen to be the current state of hiring and jobs just over the last few weeks? And what are trends looking like going forward into the next months?
Sure. So to begin with, the job market right now is looking like what you would think would look like. The trends are that uh, optometry practices have closed down for the short term due to social distancing and the coronavirus pandemic that is actually going on right now. But what we are seeing is actually organizations are now beginning again to plan for the future. So they are starting to look for optometrists to join their practice. A lot of companies, a lot of organizations like National Vision are still looking for doctors to join their practices because they do understand that once the practices start reopening, there is going to be that demand for services. So whether they were looking for a doctor before or they are looking to bring on a new doctor for a new location that they were planning on opening, there are still jobs available to optometrists who are looking to start either new careers or if they are looking for part-time or fill-in work, those jobs are available as well. And this is nationwide. I mean, it's not just in specific areas. It's not just rural jobs that are opening up. It's not just city jobs that are opening up. It's jobs nationwide. You are going to obviously see short-term trends where you may see a decrease in the total number of positions open, but over the course of the year, you will start to see more job requisitions open for a variety of different employers, everyone from the small private practice to the largest organizations.
Yeah, and here's another question that kind of comes up a lot, Brett, that, I've heard, and I'm sure you've heard, and Preeti, you've probably heard as well. And that is that are employers willing to take a chance on, even just starting job opportunity talks with new grads or even job seekers in general right now? I mean, or do you think they'll want to wait until this kind of clears the air? So if, maybe you're looking for a job, is it kind of, well, I can't even bother initiating talks with anyone right now. It just doesn't make sense. Or should you still kind of actively pursue those opportunities and at least try to get conversations going?
Yeah, I mean, if I was a job seeker right now, I'd be very aggressive in my job search. There are plenty of employers out there that are willing and happy to engage with new graduates. If you really think it through, employers actually can't bring on doctors today because they can't start working, right? The practices are closed. So employers are actually looking to bring on doctors in June or July, or even as far out as August of this year. because they do anticipate that ramp up in patient volume when they will need these doctors. So the best thing that every optometrist can do is start those conversations early. There is literally no need to wait.
Hmm. Do
And
do
then
you?
on the other,
Yeah, yeah. Go ahead. Go ahead.
well, I'm just saying on the other side of it, it's like if an employer is not looking to engage with you, what's the worst thing that's going to happen there? You know, they're going
Yeah,
to say, hey, we're not looking to engage with you today, and then you can re-engage them later in the future. You know, that's
yeah.
the worst of worst case scenarios if you do end up reaching out to somebody.
For sure. And I mean, do you think the application pool is going to be more competitive post-COVID with, maybe potentially more ODs who are looking for jobs? Maybe they've been laid off or something has happened, and now the pool is bigger. So do you think we'll see any trend changes there?
I don't think it's going to be as pronounced as it seems today. And the reason I say that is because a lot of doctors are furloughed. And what that means is that they're just basically in this holding period in a time where a practice isn't open and they can't be paid. Unfortunately, the best thing for some practices to do is furlough their employees so that those employees could then collect unemployment. The doctors may or may not continue to pay health insurance for these doctors while they're on furlough. But then once the stores reopen, they would bring those doctors back. Now, it's very interesting because today, we actually hear about this second part of the stimulus bill being passed. And if you're not familiar with this, there is something called the Paycheck Protection Program, and that bill is designed to protect paychecks. It's designed to help employers keep their staff on. Um, and with that program, what likely we're going to see over the coming weeks is that some of these employees who were furloughed are going to be rehired. And even if the practices aren't open, they'll still continue to collect paychecks. Maybe they'll be doing some work from home, but it is the biggest benefit to both the employer and to the employee if they keep them on payroll, continue to pay them, because those loans, the Paycheck Protection Program loans that a private practice can receive, those loans will be forgiven by the federal government for keeping these employees on.
Yeah, super interesting. And I know we've got a talk tomorrow that kind of dives deep into a lot of the details of these programs. And, we have a whole entire live session dedicated to finances. So you definitely want to tune into that tomorrow. We'll go kind of in depth into all this stuff. But that's a great point, Brett. And, just in general, I mean, and maybe Preeti might be able to speak more on this if she's kind of seen some of the details come in through, different types of applications or working with folks that are hiring right now. But has anything come up in terms of like, we're seeking for with someone with, experience in telehealth now, right? I mean, that seems to be a hot topic right now. Telemedicine, teleoptometry, telehealth in general. I mean, have you seen any of that pop up, or, for the folks that are hiring, the companies that are hiring, anything about interviewing? Like, how do you conduct an interview? Is it sort of through Skype or maybe through Zoom or YouTube, right? Something like that. Any trends there that you guys have noticed?
Yeah, actually, a lot of my clients are actually starting to do, instead of in-person interviews, they're doing Zoom interviews, and they've never done them before, so they're actually enjoying it and finding it more convenient. And I think they may even start that trend later on and maybe do both, like do an in-person and do Zooms initially. So I am seeing that become more and more popular.
Yeah, interesting. It's interesting how the landscape is slowly changing. And back to the first kind of question, first point you made, Brett. I mean, I said that there aren't many companies and practices hiring right now, but there are some. There are a few. And who have you seen kind of hiring right now, Brett, or Preeti? What kind of organizations are hiring, or what have you seen in that space?
Yeah, so some of the larger organizations like National Vision, My Eye Doctor, they are continuing to hire. They had their plans for the year. I know Bill can obviously speak more
Mhm.
specifically on those
Yeah,
plans
and
for
and
next
we
year.
brought in, when we do have Dr. Bill Werner here of National Vision, we asked him to join us to find out a little bit more about the opportunities available with National Vision, but just also share some tips about finding jobs maybe right now during these times, and kind of provide provide some perspective, even from an OD, right? I mean, Dr. Werner's an OD by trade, of course. We'll have him join us here, and I think he's actually on with us right now. So I think, Bill, you with us here?
I am here. Yes, thank you.
Awesome. Thanks for joining us. For those of you who don't know Dr. Werner, he joined the National Vision Doctor Network directly out of school, if I'm not mistaken. And you practiced full time with National Vision and held a variety of different positions before really ultimately becoming the director of student relations, which is where you spend most of your time right now. But we know, like Brett said, your organization is actively hiring still during these times and providing opportunities. So we wanted to have you on just to kind of learn a little bit about maybe what National Vision's doing right now to really help ODs, patients, the profession, the community. What has your response been? National Vision's response has been, of course, and just kind of get some insight from you. So welcome. Thanks for joining us.
Yeah, I appreciate it. Thank you for having me. So all of our offices nationwide have been closed for several weeks now, since March 19th. Now, even though our doors are closed, we do have optical associates working within the locations to be able to answer phone calls in regards to eyeglass prescriptions, contact lens prescriptions. If there happens to be an eye urgency or emergency case as well, then that patient is being connected with the optometrist within the location. And then the optometrist is having either a phone call or a virtual video conversation with that patient, determining what treatment is needed and what the plan is going to be for that patient. We also have a task force team within our company who is looking at a multitude of factors, determining when the best time is going to be to reopen our locations and what precautions and PPE are going to be needed when that time comes as well. Each week, our lead area doctors in each district are part of a weekly conference call with our company leaders, making sure that they're in the know on what is happening at that moment in time. And then again, what precautions are going to be being taken when the locations open up. And then our current doctors all of our current doctors are receiving weekly email communication, making sure they are in the loop. One thing we did do as a company was donate 40,000 N95 masks to the Georgia Emergency Management and Homeland Security Agency to assist healthcare workers who may need some additional PPE. I know there's certain parts of the country where they are struggling to get that additional protection.
Yeah, no, that's awesome to hear. It really is. And, I know that Brett kind of touched on this a little bit too, but, why has National Vision really continued to hire ODs while many organizations have kind of put things on hold? I mean, why is that?
So we've been quite successful over the last several years, and we've been able to open in existing markets as well as newer markets as well, allowing us to reach out to a patient population who maybe has never had eye care before or who hasn't had eye care in a long time. So we know we are going to be needed once this all passes, and we're going to play a big part in the recovery process of the nation. And I think people in general, in all aspects of life, they're going to be looking at they're going to be looking at their finances a little bit differently. And when that comes into play in regards to healthcare, we as National Vision, we're going to be able to provide lower cost options from an eye care standpoint, as well as eye health. So we truly believe we're going to play a big part within the recovery. And our existing patients are going to need eye care after all of this reopens back up. And we expect that many more new patients that are going to need care as well. So as patients are going to be there, we know we're going to need that many more doctors to be able to take care of them.
Yeah, that's a great positive, perspective for sure. And I think that's something that sometimes we forget to kind of think about. It's easy to get wrapped up into kind of the bad things going on right now, but that is a great point, Bill, that you bring up, and that the demand is going to be incredible for whenever things do really pick back up. And I'm sure there's going to be tons of patients who need care. once things get moving again. So, you know, no matter where you're practicing or what you're practicing, you better be ready, right? You know, I thought it'd be good too to have you on just to kind of, you know, have you share your experience, obviously from the perspective of an optometrist yourself. I mean, you know, do you think there's anything in particular that new grads or really just anyone looking for a job right now should emphasize in, you know, their resume or an interview or whatever it is right now? Just, you know, anything, you know, that they should emphasize, whether that's some experience they have or don't have, or some insights into different things they might know?
Well, in regards to us, we see a wide range of patients, those that are more straightforward, all the way to ocular disease management cases as well. So when we are hiring doctors specifically, we are a larger primary care setting with a large contact lens patient base as well. So when we're hiring doctors, we're looking for candidates who are interested in that aspect of the profession, and are comfortable and confident in fitting contact lenses as well. I would say in general, if, let's say, for example, you're going to be interviewing for an OD MD clinic, and if it's a new grad, a student that's going to be graduating rather soon here, maybe you don't necessarily have as much experience as somebody that's been practicing for 5, 10 years who may be interviewing for that position as well. So I would say discuss your clinical rotation in ocular disease with that interviewer. If you are going to be interviewing for a pediatric vision therapy clinic, again, discuss your clinical rotation in vision therapy that you had. When we graduate optometry school, we graduate with a ton of knowledge. We don't always necessarily graduate with a ton of experience as well. So I would say just make sure you are really getting across your desire to be the best doctor that you can, and that you are going to be willing and able to learn as much as you can on a daily basis as well. And if you do that, you're going to put yourself on the same playing field as maybe somebody who does have that more experience as well.
Yeah, that's great advice. And, you know, as a new grad or really even if you're just looking for jobs, I mean, do you think that there's any key questions that you should be asking when it comes to just, you know, connecting with potential employers or just job searching right now? I mean, you know, not just during the times of COVID, but even post COVID. I mean, are there, you think there are like specific questions you should have in mind or things to remember?
Yeah, for sure. Well, in regards to COVID, make sure you're understanding the reopening process when that day comes. So are there going to be reduced hours that the doctor is going to be seeing patients? Are there going to be reduced number of patients that the doctor is going to be seeing, to be able to allow for extra time cleaning the exam lane, cleaning the equipment? So truly understand what PPE is going to be provided as well. So truly understanding that reopening process, I think, is key during this time period. There's several things I would be asking if I was interviewing for a job at this point, and one is in regards to contracts. So there's a couple big things that you need to look at when looking at a contract, and one is the termination clause, and then also looking at the non-compete clause. So I always like to say you never want to be stuck in a situation where you're unhappy and you don't feel like you can't leave because of either of those two factors. A huge benefit of our contracts is we have a simple termination clause and we do not have a non-compete. So nobody is limited from practicing elsewhere if they did ever have to leave for whatever reason. You're going to want to ask questions in regards to the support that's provided not only inside the office, but outside the office. So inside, how many receptionists are there going to be? How many opticians? Is there going to be an office manager? Are you going to have an optometric technician who's going to be able to provide the pre-testing for you? Or are you going to have to do that? You know, all that pre-testing we had to do ourselves in optometry school. Are you going to have somebody assisting you with that, or do you have to do that yourself as well? Outside the office, if you're joining a larger organization, if you ever have any clinical suggestions, concerns, suggestions, are you going to be able to reach out to another doctor and be able to discuss that with, and that doctor is going to be able to understand what you're going through on a daily basis as well? Are there going to be administrative tasks that you're going to have to do? Hiring and firing of the staff? Are you going to have to do your own billing and coding? What hours are you going to have to work? Are you going to ever have to be on call and come in later in the evening or in the middle of the night to see a patient? You're going to want to look at that benefits package. I mean, finances are going to be key, not only now, but of course, always. So look at that entire benefits package. Is there going to be medical and dental provided, a retirement plan? Is there going to be paid time off or paid vacation provided as well? Continuing education, is there going to be an allowance to be able to get your CE? So there's multiple things, and then also referrals. I mean, if you ever need to refer a patient out for whatever reason, are you going to be able to refer to whichever doctor you want to, or are you going to be dictated on a certain practice that you have to refer to? So there's multiple things I would be asking myself, and those are just some suggestions that I would be telling people if you're going to be interviewing for a position. Make sure you're looking into all of those details.
Yeah, if you're watching this and you weren't taking notes, you probably should have. That was a great list of things that you shared there, Bill. But you can of course watch this afterwards too. This will be made available. But Bill, I've got another question here for you, and this question kind of pops up a lot, and I think someone had even kind of brought this up and submitted this as a question too. But do you think that the job market for ODs will be impacted once the present situation resolves, or do you think things will kind of return back to, and I've got quotation marks here with my fingers here, normal? Because I know that, just kind of seeing the landscape of jobs, and Brett, of course, you spoke a little bit about this before, but it was kind of a job seeker sort of market before, where you pretty much could find a job almost anywhere at any time before. But you think that's going to change going forward, and what might that look like?
I think it's pretty naive to think that optometry is not going to be affected to some degree. Obviously, the entire world is under a pandemic at this point in time, and most jobs, if not all professions at this point, are being affected to some degree. So yes, I do think it's going to be affected to a certain degree. Now, I think there might be larger corporations, larger practices that may be better suited to be able to handle this versus maybe smaller practices who haven't been able to put aside funds in an emergency type situation. I understand that this is probably something that nobody truly could prepare for on this grand scale, but there are going to be some practices that are going to be able to come out of this stronger versus others as well. Now, in regards to the job market being out there, we are optometrists. Our clinical skills are always going to be needed. Patients are always going to need eye care as well. So I do think long-term, we're going to be just fine within our profession. Now, let's say, for example, you graduated a year ago and you were interviewing for jobs. Maybe at that point in time, you would have had 4 or 5 job offers for a certain area. And this year, maybe you're only going to have 1 or 2 of those offers. So I would say make the best of the job opportunities, the offers that you're getting at this moment in time, realizing that once the economy opens up and rebuilds, the job market is going to open up eventually as well.
Yeah, I agree. And, I got I have a couple of other questions here that I wanted to kind of get your input on, but, some of the questions that came in through the group chat here kind of border along these questions anyway, so I'll throw them at you. But, what I guess right now for those students that are just graduating, right? I mean, they might have a little extra time on their hands. So, what are some of the best ways that they can occupy their time? I mean, what are some things that they can do now while they have that extra time, whether that's different ways to kind of improve their clinical skills or refine their skills in some way, or kind of just prepare for life in practice. And, specifically, I'm looking at the questions that came in, and some of them were kind of bordering along the whole licensing process. Like, should we use this time to apply for our licenses? Is that going to get delayed? Or, should we even apply for jobs until we get our licenses? So, I don't know, maybe now is a good time to kind of start the whole licensing process while you've got the extra time.
Yeah, I mean, really to use your time now that you may have some downtime, I've come across practices and organizations that are providing free CE, continuing education course. So I would say this goes towards both new grads, students, as well as current doctors out there. So if you're able to take advantage of any free CE courses or any free webinars that are being provided, take advantage of that. And there's also some that are at more of a discount as well. Reading optometric publishings is always various optometric publishings is always a good idea. Reading up on Will's Eye Manual. I know we all love to read up on Will's Eye Manual and keep up to date on the various diseases and things we may see as a practicing physician within our offices. There's probably some opportunities within the community to become more involved as well during the current circumstances. I know I've come across certain government and private and faith-based groups who are looking for volunteers within their communities to be able to help. Granted, they have the right precautions and the PPE to be able to do that in certain areas. One thing I would say in regards to licensing, definitely look at that process at this point in time and what is going to be needed for each state. All the states require something different. So look at that process at this point if you have not done so already. And depending on the state, you may be able to submit your license beforehand, before you have all of your NBEO Part 1, 2, or 3 results. But there might be some even before you exactly have your diploma as well. So look at all of those things that may be needed for that specific state. And then when you're talking to potential employers, I would say, yes, definitely reach out to potential employers and have a conversation. Even if they are not specifically hiring at this moment in time, you're going to be on their radar for later on when they do eventually start to open up and hire.
Yeah, we got another question that just popped in, and Bill, you can definitely speak on this. Brett Preety, this seems like it's kind of pointed maybe towards you if you guys have seen a lot of these kind of situations, but specifically, what are some common mistakes that you see applicants make that hurt their chances of getting an offer, securing a job? So I'm pretty sure we probably all can speak on this, really. So Brett, I don't know if you've seen anything.
So I know Preeti can talk a lot on this. She's seen it all, but a big one is follow up. The biggest mistake that I see candidates make is that they do not follow up. If they have an interview, they're not sending that follow-up email after. If they're even receiving a job offer, they're not even sending a follow-up email to describe that they've received, thank you, I've received your offers, I'll be reviewing this, whatever it may be. After a phone interview, after every engagement, there should be a follow-up. That would be the first thing that I would recommend. The second thing is always clean up your resume. Your resume is really that, it's that first opportunity to present yourself in the most professional way. So if you have a resume that doesn't have any spacing, it doesn't have any bolded headings or anything to make it look just nice and organized, it doesn't have to be like a beautiful work of art, but it should be nice and organized. If you don't have that, that's a first critical element in getting a hiring manager or a hiring doctor to engage with you in that next step. Preeti, do you have other big ones that you see there?
A lot of times, a lot of candidates may not do the research into the company or the practice that they're interviewing for. So a lot of times the doctor wants to know if the candidate has actually done a little bit of research, looked into the practice, and, they want to know that they are, invested. And so a lot of candidates sometimes don't do that, and sometimes not talking about their experiences, kind of giving short answers when they could elaborate and give more examples about what they did in rotations or clinics.
Yeah, just to add to both of you guys as well, I agree with everything you said. I always tell people as well, keep in mind that any interaction you have with anybody, treat it as an interview. So let your personality shine throughout every communication that you have with somebody, because personality goes a long way in determining whether a candidate's going to be a good fit for that particular practice.
Yep. I think that seems to be all the questions that kind of came in right now. So we're just about out of time, but I wanted to thank you, Bill and Preeti, Brett, for kind of hopping on with me, talking the current state of affairs, jobs, and sharing top tips and everything. And for those of you watching, if you have any other specific questions for Bill or just National Vision in general, you guys can definitely check out their booth and talk to the folks there. Just, you can leave them an email, chat with them, whatever, and they'll be happy to help you out. But, thanks again for the time, and it's always a pleasure.
Thank you for having me.
All right, we'll pick back up again with the next session in about, I think we've got a little bit of a break. So if you're following along with us throughout the day, we'll see you in the education lobby in, I think, a little less than an hour. So see you guys then.
Thanks, Antonio.
Bye.